The CJFL is constantly looking for ways to keep our players safe and are committed to providing the safest environment possible. And that's why the Canadian Junior Football League is now partnered with the software company HeadCheck Health. And to tell us a little bit more is Harrison Brown from HeadCheck. Hi, Harrison.
Hey, Ryan. Thanks for having me.
Yeah, this is exciting. So first and foremost, what is this software? How does it help players?
Yeah, so HeadCheck Health, we're a digital health company based in Vancouver. Originally, it was a spinoff from a concussion research lab at UBC. And what we do is we essentially provide a digital health platform that simplifies the process of executing and monitoring adherence of teams to their concussion policies. So the idea here is that we're really standardizing across the whole league. You've already got a protocol that exists that says, hey, whenever the injury happens, we're going to do A, B, and C. And our system is really used not only to help do that, actually complete A, B, and C in an easier fashion, but also to drive compliance to it. So if we find situations where maybe A, B, and C aren't happening, making sure that the players are getting the best care possible.
And that's important, and you mentioned standardization because we have teams across the country, as the CFL does, as university does, different financial positions. HeadCheck is able to allow every team and every player to get the proper treatment. So standardization, it must be what you're built on. It's so important.
Yeah, exactly. I mean, there is a protocol for the league already, right? And the idea is that it doesn't matter what team you play on. If you're on, a good team, a bad team, a new team, an old team, you shouldn't be getting different care when it comes to concussion. There's best practices and there's protocols out there that are already, written for the league. And so really what HeadCheck is aiming to do here is just make sure that those things are happening. And so that it doesn't matter what team you're on, you're going to make sure that you're getting at least this high level of care that the CJFL is going to provide you with.
And you're not a new company. You're working with the CFL. Some schools at U Sport are also using HeadCheck. And are they finding it beneficial?
Yeah, absolutely. The company's really grown, especially in the last few years here. We work with about 800 organizations split across Canada and the US mostly, different sports, different levels. But yeah, the CFL was an early adopter of this technology. We've been in there for a number of years now. And similar to the process that we've taken with the Canadian Junior Football League, with the CFL, we started off with a pilot. So we piloted it for a year with one team. It was a successful pilot. It grew to, the league adopting it. And now it's absolutely mandated across the entire league. And that's essentially the same process that we've taken here. So we started off a couple of years ago with one team, the Hilltops. And after successfully implementing it there, we then expanded it to the PFC. So that's all the Prairie Conference teams. Again, a successful pilot there. And then now we're ready, to adopt the whole league and make sure that this is the same program used across, the whole country.
So how does it work? A player gets hurt on the field. It's determined he has a concussion. When does HealthCheck check in?
Yeah. So again, there's already a protocol that exists for what's supposed to happen. That's already defined by the league and the medical advisors to the league. So there's stuff that happens pre-injury. So, in the preseason, a lot of teams are now doing baseline testing, collecting some basic information on the athlete when they're healthy. So that will now be done on the HeadCheck platform. All of those tests, there's a wide variety of tests that the league will be choosing. They'll run those tests on the HeadCheck platform. The data will then be stored under that athlete's profile. Then if an injury was to happen during the game, there's kind of two different ways that the protocol will work. There's kind of an on-field assessment, which is again in alignment with other football programs, where essentially the medical staff will do an initial assessment to see, hey, should we pull this player and do a more advanced, more in-depth analysis of their brain health in the locker room. If they decide that's the case, they'll go into the locker room. They'll do a much more comprehensive set of assessments. At that point, a physician will be required to give a diagnosis. Once the diagnosis is given, it'll really plan out the return to play protocol. So normally there's a standardized set play for recovery. There's usually 6 steps. It goes from a graded return to play from no activity, make sure that they're healthy, no symptoms, all the way up to light practice, contact practice, and eventually gameplay. And all of that process will now be managed on the platform so that we can make sure that every single player who has a suspected or diagnosed concussion is actually going through that process. And again, that process is defined by the league. We're just helping make sure that it actually happens.
Can something like a concussion be improved by HeadCheck, or I guess, early indications of a concussion or a second concussion for a player? Can it be improved by HeadCheck?
I mean, I wouldn't say necessarily improve, but you know, there is a lot of literature out there that says that if the athlete's got a concussion and they continue to play, or they're removed and they go back too soon, the second injury can be much more devastating, and that's where you get those long-term deficits that are associated with you know, prolonged recoveries. So again, what we're trying to do here at HeadCheck is make sure that when players are suspected of the injury, the right steps are taking place to pull that player, and the right data is being collected, and the right people are making the decisions on their return. So theoretically, you know, we should be helping the league get the right players off the field and put them back on when they're ready to go. And, you know, the data behind that supports if you pull a player earlier, their recovery will be shorter and the risk will be lower, because that chance of a second injury, you know, will be prevented to some extent.
Some parents that may be watching this, if they have younger kids that are in football, is that something down the road HeadCheck would like to look into, some of getting into the minor leagues and the grassroots programs as well?
Yeah, I mean, obviously it's a little bit different when you go down to that level, because you don't have medical staff at the same level that the CJFL or the CFL would have, right? HeadCheck does have a solution for those levels. It's a different product. So the product that's going to be used in the CJFL is called HeadCheck Pro. That's the same flagship product that we use in all the professional sport leagues that we work in, as well as the universities. So, you know, CJFL is going to be using this Pro version. There is a youth version, which is called HeadCheck Manager, and that's really catered towards individuals that are not medical professionals. So if you've got a, you know, volunteer coach, or, you know, a parent that's there and they're the one that's supposed to activate these protocols, we don't want them using the Pro product because they're not qualified to. We don't want to turn a volunteer coach into a doctor. So that's the reason why we don't provide them with that flagship product. But we do have a product that's catered specifically to those individuals, so they can still continue to use the product to make sure that the protocol is being followed, but just doing it in a way that's appropriate for a lay individual as opposed to a medical staff.
For medical staff that are part of the CJFL or even the CFL for that matter, what kind of training do they have to go through? How long before they're certified and can actually use HeadCheck?
Yeah, I mean, just coming back to the whole concept, the tests that they're going to be running, the things that they're doing during the return to play process, those are things they're already doing, or things they're supposed to be doing. So HeadCheck doesn't play a role at all in training people on performing those assessments or making decisions. These individuals are qualified. They've got certified athletic therapists throughout the league. There's team physicians that they can refer people to. So these people already know how to do exactly what they're supposed to do. We're just making it a lot easier. And I think, you know, the training that we do provide to all these staff are, hey, your protocol says that you're supposed to do A and C anytime there's an injury. Well, this is how you can use HeadCheck to make sure that it's going to be easier to do A, B, and C, potentially save you some time, and also provide you a way to go back in and review the data to make sure that you're making informed decisions. So there is training that's provided by the company, but it's more so technology training as opposed to actual training on the process.
Well, we're looking forward to it being implemented here in 2021. Fingers crossed we do have a 2021 season. Harrison, thanks for doing this from HeadCheck. Again, HeadCheck Health, thanks for partnering with the CJFL, and look forward to seeing how your product works.
Thanks, Ryan. Yeah, really looking forward to a safe year. And I just wanted to tip my hat to the executives at the CJFL. I think this is a huge step forward in terms of player safety, sending that message to the community and to the players and the parents of these athletes.